right. So, what are your general opinions of Barack Obama?
Once you start off,
Brendan.
we might be here for all 15
Me
minutes.
first.
You first.
Pass. I don't want to start this one.
Justin, what are your opinions of Barack Obama?
I like his environmental views, but I'm not a fan of him in general. I don't agree with a lot of his policies.
All right. How about you, Ryan?
I don't like him or I don't dislike him, so
I'm the
very
same.
neutral on him.
I don't know. He's not that bad though. He kind of got dealt like a shitty hand.
Yeah.
I actually kind of like Obama.
Really?
Yeah.
Oh.
I don't really pay attention enough to like
That's
him or dislike him. He's just kind of there.
You did make a good Bush kind of
Yeah.
gave him a
Well,
bad,
Bush gave him a bad.
He's
a
already
bad
involved in a
start,
huge war and
Exactly. But he also hasn't been the best either.
could be better.
And what are your opinions about universal health care as a whole? Not like specifically in the United States, but just
Like Canada.
in like Canada, Europe,
Yeah.
like how it works over there.
I think Canada has a good system.
Canada's a
Nobody
great
pays
system.
for their health care.
Mhm.
It's just provided by the government. I think that's
Yeah, but their taxes are like, it goes up to like 49,
but what would you rather do though?
50%
Would you rather have
of their
health care?
income.
Say you have surgery.
Mhm.
You're gonna owe $100,000 for a surgery on your back or whatever.
No, I'm not saying I don't like the universal health care. I do
Yeah.
agree with it, but
I would pay more taxes to have
Yeah.
health care covered because you don't know what you're gonna run into.
But do they raise the taxes of the higher class or all three classes?
they'll raise it all.
I don't know.
I'd see that.
I mean,
think that would be
the
a big
higher tax
contributing
brackets
factor.
are at least 40% if you make over $300,000 a year. I think. So,
I don't know. Everybody deserves to get treated.
Yeah,
though.
definitely. You shouldn't have
can't
someone if you can afford it.
Yeah.
Treat your people.
Yeah.
Okay, so we're gonna treat the people who Obama is right now trying to make I forget what the number is that the people who just.
All right. Well, that brings me to my next
came
question.
to
What's your
country
opinion of the Affordable Care Act?
Like service and all.
So like that's
Yeah.
that's what you're going off right now. That's your opinion of the Affordable Care Act, right?
Yeah.
Yeah. So what was that again?
I don't know. I think it's a step in the right direction towards universal health care, but I don't necessarily like his policies, and I don't know. I guess it's all right.
What do you guys think about the Affordable Care Act as far as you know of it as of now?
I don't really
That's
know
like a
too much
service
about
center
it.
question.
Yeah.
I mean, I like
don't
the
know
fact that you
much
can
about it.
stay.
It's kind of sad how little we all know about it.
Yeah.
I know.
And stuff in general.
I like it. How you can stay on your parents.
That is cool.
You can stay on until 26.
I think that's just part of all healthcare.
No, that's part of the universe.
My parents, I'm on there.
I thought it was
till
till like
25.
27.
Okay. Yeah. That'll bring me to there's one of the questions is
I could be on my parents. until
Yeah, one
26,
sec.
and
Yeah,
maybe
my-
just have,
I-
like, Anthem
Mine's
Shield.
through like
Use
company.
your phone.
Yeah, exactly.
Did you take a picture?
No, I did, but this is easier. Where is it?
What are you looking for?
What's a brief explanation of the affordable?
I do have that.
There's two parts of it. One's focused on prevention. The other.
Okay, yeah, it is.
focused on-
Yeah, you'll be able to send your
Education.
parents healthcare until the age of 26.
Yeah.
So you guys all are in favor
Well,
of that,
so-
or what are your opinions on that?
Oh yeah, I'll be
Yeah.
on as long as I can.
Same
Yeah.
as mine.
Yeah.
Definitely.
If
But then again, like a lot of jobs do offer healthcare. Like
Well, they
Yeah,
offer
but it's
they offer
also expensive
benefits.
to take it
That's
from your own.
decreasing. They're decreasing the amount of.
I just- I mean,
benefits
the-
they give you.
like-
so was
the
it?
job like I just got like kind of offered like they offer healthcare and shit. And, like,
Every place
That-
I've
and that's
applied,
not-
they make it like a point that they include health.
But the
benefits.
one
just cost that
requirement
salary,
that they
right?
had with me was you had to be full time, and there's like a lot of like
Part time.
random part time jobs. That
What
people
was the
do.
rule before this? If you were
I
at
thought
a
it was
certain
26
age,
or 27 either way. You stayed on there.
Yeah.
It was your choice. I think after a certain age, but you can stay on there until like.
okay, so it just
27.
extended the amount
I
of
think
time.
I'm not positive, but
So, if the Affordable Care Act will give access to nearly 32 million Americans under the age of 65 who are under 133% of the federal poverty line, to pay this, there will have to be a rise in taxes for individuals making over 200,000 annually and families making over 250,000 annually. Would you guys agree with that? Disagree? Or what are your opinions on that?
Do you know how
I didn't
big
get
the
it
increase
correctly.
is or no?
The increases?
Yeah.
It's well, nearly 332 million Americans will have access to affordable or to healthcare.
Yeah.
But
What percentage would cover that amount?
the people who individuals who make
Oh,
over
above
200,000 and families who make over 250,000.
Wasn't the
Are they
Affordable
gonna-
Care Act
they're gonna
focused
take-
on the low income?
Yeah, but the taxes
So
will
they're
rise
taking
for
money
that
from
for
the
They're
those.
pretty much
Wow.
making the people that can't afford
Yeah.
because their incomes are.
I mean, you
Lack of
really don't
income.
need that much money though. It's a fucking ridiculous amount.
Yeah, well, no.
Yeah,
I
but
agree
no,
with
where you
that.
draw the line though,
Yeah.
because they're
So,
earning it.
yeah, so
One way or another.
That is
like,
a
they're,
family,
like,
yeah. They are
Like,
earning
you're
it.
earning it. Like you shouldn't. I would be pissed if I was like an anesthesiologist or like somebody that was making like.
You went to like 8 years of school.
8 years of school. If I was like a doctor and like practicing my own thing and was making like $500,000 a year after busting my ass, I wouldn't want to give it to some guy. Like
Yeah, it's true.
that's why I mean, everybody makes fun of the 1% and all that stuff, but the fact of the matter is the 1% individually pays more taxes than a lot of people like combined, because it's like 40% of their income. But
Especially in places like New Hampshire where the income tax is huge, isn't it here?
the residential tax I think is like 9% to make up for like it's not beer or anything like yeah. Well, it's weird because there is sales tax on certain things like
Food and beverage. I
Yeah.
think. Yeah.
At
Well,
like
not
restaurants,
beverage.
it's like
Yeah, but or like
it's
just
like
like
pre-made food. Like
yeah.
okay, wait, that's getting off topic. Alright,
Talking about food.
Alright, so businesses with over 50 employees will be required to offer health insurance. Do you agree with this, disapprove with this, or what are your opinions on that?
Disagree.
Yeah.
15 employees.
15?
50 employees. If they have 50 or
50
more
is a huge
employees, they'll be
operation.
required to offer health insurance.
50,
I think it should be lower than that.
yeah, like
It should be-
that's
it
a
should
lot of
be way
people to have
lower
on
than that.
payroll.
The
Yeah,
places
you
that
know,
like
That's a fairly huge company.
I'd
Yeah.
say 25.
That's
pretty big.
Alright, well, how about small businesses with less than 25 full time employees who offer healthcare coverage would be eligible to receive a 50% tax deductible?
I'd agree
Wait,
with
pretty
that.
good. I mean, yeah.
Yeah.
Say that
The,
again.
the place that I worked at last summer had a total of like
what's that?
10 employees, and they still offer health benefits
Yeah.
and everything.
So, kind of.
I think if you're full
Yeah, it
time
said it's 20 less than 25 employees will be offered deductible up to
and
50%.
they're full time.
Yes.
Yeah, so
Yeah.
the full time's big. Like,
Yeah, I think if you're full time,
And
And
a
it's
small
like-
business, they deserve that.
yeah,
So
and
does
there
that
should be programs for those type of.
does that change your guys'
businesses, too.
mind any
There
at
should be
all?
like
about the 50?
incentives for those businesses to give everybody. Like that's the thing. They have to work like. I think they have to work within the insurance system itself and like,
But
make insurance
Mhm.
companies give incentives to those like businesses. Like you get government incentives for
But
giving small businesses.
Does that change your guys' opinion at all with the 50 people with businesses with 50 or more employees having to offer healthcare? And what would you think about that compared to the 25 who gets a deductible? Will that change your
Well,
opinion
is
at all?
I
this-
mean, there should just be a minimum. It shouldn't be like. I mean, you can scale it based on how big you are in size of a
Yeah.
company, but I think there should be like, if you are this size of a company, you have to offer this, and so on and so forth. And the bigger you get, like, it's gonna be like mandatory.
Yeah.
Are you gonna
like-
offer it by people or by like the profit that you make?
I was gonna say like,
Yeah.
like the actual gross like product that they make because like if you have like 4 people working for a company but you guys are reeling in like
Mm-hmm.
hundred or I mean like $1 million a year between like or like each.
You could have
They
a
should
firm
probably
that,
pay a
like,
lot.
effective
If you're like a
fees,
law firm that's like killing it, but then again they probably can afford healthcare too. So like
yeah, just like more strict limits. A broader range.
So the individual mandate requires that all citizens must obtain healthcare coverage by January 2014. Otherwise, they will get an exemption. Otherwise, if they have an exemption, if they don't have an exemption, they'll receive a fine.
Can I
What
get
is
that one more time?
I'm reading it from a weird angle. It looks weird. But the individual mandate requires that all citizens must obtain healthcare coverage by January 2014.
Okay.
Unless they have an exemption, they will receive a fine. How do you feel about that?
How do you receive an exemption?
You have to like go through government to get
You
one
have to
for their.
apply?
Yeah, you have to like talk to them about the reason.
That's
for
kind
a
of
while.
tough. I mean, that's like forcing someone to get a job
Mm.
by a
Yeah.
certain deadline. Like the market's shitty,
yeah.
I would say for the job, like for
And what-
everything right now. Like
Mhm.
I think. Well, what year did you say by? 2016.
2014, so it already passed.
Yeah.
Oh, well,
Okay.
So-
I don't really know how to say it.
Yeah, but do you think that? Do you think that
There's-
that's fair? Do you think that's
So they're forcing them to get health
unfair.
I
care.
think they should have given them at least 2 years.
Yeah, it's like
after-
forcing someone to get cards.
Is this an individual
Yeah,
or
But
the
they're-
company?
it's forcing
we're
them to get
talking
health
about?
care.
Right.
But you
If they
also,
don't want
but they
it,
had since
why, like,
2010
have
to
people
do
pay for
this.
it?
I mean, it's gonna save the government a lot of money. You can't, you can't
What if they don't wanna
refuse.
do
You
it?
can't refuse a patient if they walk into the
Yeah.
ER. So it's gonna
But
save them a
exactly,
lot of
that's
money.
the problem they're trying to fix. Like,
But like, what if you don't want insurance?
Then
Well,
you'll just be like feeding off there.
then
Then they're like,
yeah,
it's just pointless money.
Yeah.
You know what I mean? So like, you shouldn't get a fine for not having it if you don't want it.
Yeah.
Yeah, no, they should make the exemption process really easy.
Yeah.
Like,
Yeah.
if you don't want to do
Just
it,
physically don't
that's
wanna do it.
completely fine. But you shouldn't have to like be
Yeah.
eligible for exemption. If you want to be, if you don't want it, then you should just be able to declare yourself exempt from it.
Yeah, as long as you like file
shouldn't-
some sort of paper.
You shouldn't have to like qualify or like.
But
Make,
then
like,
what happens when somebody doesn't like they don't want to do it, so they didn't sign up for it,
Mhm.
and then so like 'cause that paperwork takes a lot to do.
Mhm.
And then all of a sudden, one of their kids it's like cancer.
That's their
And,
problem
like,
then.
Well, that's
But
true.
But then like,
well, they didn't. No, they didn't do it. They could have, but they chose not.
but
to.
okay then. But
Yeah.
a lot of people don't
yeah, it's
want
almost
to
like-
like, do that. A lot of people would want to treat the person who has cancer, but then
Right.
But the thing is that like that type of person that can't afford like the insurance themselves, like through the Federal Affordable Care Plan Act or whatever, like they wouldn't be the ones that are worried about getting cancer and shit. You know what I mean? Like they would have other resources to
They
like
would have the
pay
funds.
for it.
Yeah.
Mhm.
like you know what I mean?
Justin Dave did just in
But what if
case.
they didn't? What if they
but if
like?
they did, then they should
well,
have signed up because
Yeah.
That's what I'm saying. But like, that's
Some people
gonna-
will just-
that's
It's kind of
gonna
a, it's kind
happen
of a gray
so
area.
much
Like,
though.
Yeah.
It's up to the family.
That will happen so much, and like, I don't know. You kind of gotta push people into it.
People
though.
just won't do it.
Yeah, but
You
Yeah,
have to
exactly.
somehow-
It's
making
hard. Someone
making everyone have
Not everyone.
insurance.
No,
That's what it's saying.
That's what
Like,
it's
you
saying,
have to
right?
have insurance.
But-
like
but what percentage of the
Yeah.
population actually is that? Because I'd say like I'm throwing some number out there. but
U.S. population.
I'm saying like 60% probably already get it from their employer and don't have to sign up for Obamacare.
Is
no,
My
wait,
parents don't have
60% from their employer.
What's
No
the- what's
way.
the
that's
unemployment
high.
rate?
No way. Give it like 20%
What's the
maybe.
unemployment rate?
it was probably at least
Is it like
5%.
5 to 7.
Yeah, it's
Yeah.
bouncing like from 5 to 7.
So that's 7% automatically.
Yeah.
And
So you're down
then
to 93.
what
So
other
then-
percentage don't like? Do you
So you're
think
saying
actually?
A huge portion of employers are dropping all coverage, all health benefits, massive amount. They're focusing on just having part-time employees, just so they can not fucking offer them
I mean,
the
like, okay,
benefits.
like Walmart.
Yeah.
No, seriously. though.
No, they are. They'll sign up people like just for like 30 hours a week just so they're shy of
Mhm.
like. Okay. Yeah.
Yeah,
No,
they're
that's
like
a good
shy
point.
of like the actual point of like full time.
I'm just used to seeing like a lot of people who have health insurance through jobs, but
The Affordable Care Act states that insurance companies will no longer be allowed to turn away individuals who are already sick. What are your guys' opinions on that?
I don't think anybody who's sick should get turned down.
Yeah. Like, so you're saying like a cancer patient who goes and tries to get it?
Yeah.
Okay. Yeah, I think they shouldn't be. turned
So they
down.
can't. Well, they can't turn them down from what?
Anyone who's sick
You're a high risk patient.
insurance companies
Right.
will not be allowed to turn down like anyone who's
So they have to
sick.
take you
They're an
on.
insurance
Yeah.
company. They should have to
Yeah,
do it no
that's
matter
their
what.
Yeah,
job.
they should do it, yeah.
They should be able to do that.
But I mean,
The whole
It's
basis of
America.
their business is everybody to pool the money
Mhm.
together
Yeah.
exactly.
just in case something bad happens. Like that's what you do,
Yeah.
which I think they should do.
Yeah.
And I mean, I think they could even make more affordable plans too for people like that instead of
Mhm.
charging like the nominal rate or whatever it is. Like,
Even if they're doing
Ryan,
some
what do you think?
contribution.
Nothing.
I
No, I just thought of something funny. So I was
saw you smirking. I know.
no, it's completely unrelated.
Okay.
All right, we good?
Next touchdown.
Yeah.
You better hit him on the couch. All right. All right. So, although Medicaid is being expanded to cover more individuals, not all states have to agree to the expansion. What is your opinion on states having the choice whether or not to expand?
Ooh, that's tricky.
Okay, that's tough. You remember one more time?
So, although Medicaid is being expanded to cover more individuals, not all states have to agree to the expansion. What are your opinions on states having a choice of whether or not to expand?
I think it's going to make it really hard for the voting process
Mhm.
because that's just going to make certain states that back that are going to want to. They're going to be coveted by the candidates so much more because if they get their backing, then I mean, it just means better things for the candidate in the presidential campaign.
I think it's gotta be like nationwide.
Yeah, it
'Cause,
has,
like,
it has to be a movement
What if
everywhere.
let's say
What if you
Massachusetts?
move,
Let's say Massachusetts has it and New Hampshire doesn't. How many people are going to flood Massachusetts?
right? Yeah,
And
That's
how many
true.
people like? Then you're just going to like get people's own
Good
back. I mean
point.
that.
that's a really good point. Actually.
Yeah, just like
I didn't
move
think
across
about
like
that.
Yeah,
10 minutes
just
drive
for that
just to
reason.
get free. Yeah.
And then you get like some of the more liberal places are probably going to become like less economically wealthy.
Yeah, there should be a vote like
Yeah,
in the
like-
entire country, and then if it passes,
Because like
do
that's
it.
something like when it's like comes to, like gun laws or something like that's a little off track, but like that's like something you can do like manage. But like healthcare is so important to people's
Mhm.
lives that like you need that to be like universal. I think.
That sums it up.
All right, so Medicare payments towards doctors who cover patients with the insurance have not been timely, causing problems within hospitals who need that money to remain open, which then raises the cost for everyone. What are your opinions on that? So hospitals who are offering to take in patients with Medicare and Medicaid and things like that don't get payments from the government timely, and that raises costs for the hospital when they need that money.
Because they still have to pay for it.
So yeah, they still have to pay for everything
hire
else.
more people, like set up a better system.
Government has to pay for it. Like
Yeah,
But yeah, the problem is they're not paying for them as quickly as they normally would, as if it wasn't someone who's covered by Medicare or Medicaid.
oh, I see.
Yeah.
Like they're putting them on the bottom.
Well, that's just in the insurance
yeah,
company.
and the government has to get their shit together
Yeah.
too. They
Yeah.
can't just not pay. Like I don't know. We set up this program for a reason.
Mm-hmm. They got to back
Taxes
up their,
go up for a reason. They have to.
Put their money where their mouth is.
Yeah.
Literally.
So, although the Affordable Care Act allows for free market health insurance field to survive, it also creates higher health costs compared to countries who use a more universal system. What are your opinions on that?
I thought the idea of the Affordable Care Act was to lower the cost, not to raise it.
I think it's just make it more accessible and affordable for everybody. It's gonna cost more for some people rather
And
than others.
I also think the difference is the universal is everybody's on the same boat. Where the thing that the Affordable Care Act is trying to do is, I think I could be wrong, but I think like it's voluntary where you don't have to do it. It's like people in like universal like countries like Canada and
Yeah, you have the option of going on the health insurance the government provides, or and paying for that, or you have the option of going to
Private
a
hospital.
private hospital or
Yeah.
private health insurance people, like
Yeah.
ones that are through your government or through your employer.
So if you have a lot of money, you can do that one.
yeah.
Well, I mean, there's a lot of money. Sometimes a lot of employers offer you health insurance, and you can take that over paying for because
Even
you
when
always
there's
have to pay
universal
somewhat
healthcare?
into health. Which,
Even when there's universal health care.
well, no, I'm saying that they offer that so people take that choice,
Oh.
and it then raises the cost of other things compared to as if there was universal health care. Because Affordable Care is not technically universal health care
It's not-
because
yeah.
of the way that it's set up.
I mean, yeah, it's all about weighing like the pros and cons because you can't have like if you're gonna make something more affordable, something else is gonna have to go up in cost. Like it's just how it goes nowadays. So I guess it would just come down to if people are willing to pay extra for
The
whatever
private
it is, it would have to go
insurance,
up. Yeah, in order for that to raise it, and that would have to go to a massive like nation vote. I feel like, but
So, do you believe that everyone deserves health care coverage? What are your opinions on that?
yeah,
100%.
it should be part
Yeah.
of your it's part of the
100%.
Constitution. It should be part of your free will.
Every
Not
citizen,
only- yeah.
citizen, they deserve
Yeah.
it. But if you're coming into a legal,
So you don't think of
perspective,
any reasons why anyone shouldn't deserve healthcare coverage?
Because it not only helps the person that is sick, but what if they have like a contagious disease that's like really bad?
Right,
and
it helps
can't,
you- it
like,
helps
everybody
everybody.
else as well. You know, if everyone has it.
Okay,
You're
so
only as strong as your weakest member.
do you guys
Join the weakest link.
do you guys believe that the Affordable Care Act directly affects you?
it will.
Not
yeah.
now, but it will.
Yeah.
Yeah,
Yeah.
definitely.
If it's still
Eventually,
around, I
for
mean, if it's still around,
Yeah. I
because
mean,
it could go away after this next election.
I was gonna say
And
yeah.
that's not going to impact us really until we become of age too.
And it honestly, there's a good chance it could because
Mhm.
Republicans will probably not take the Senate, but
No.
but still,
but-
no matter what.
I don't think it's going to affect us directly, but it could if during the next election it's carried over. But I don't think it's going to be because there's a lot of people,
Yeah, there's a lot.
And
there's a
I
lot of
hope
negative-
that
a lot of bullshit.
My
about
college
it, so,
education gets me a job that I can actually get healthcare.
Yeah.
Yeah,
I'm
that's,
not
the,
trying to go around that.
that's the
That's-
dream.
that's the goal.
That's the dream.
Here it is.
All right, good shit.